I'm Art Flewelling, and I've been with Kaiser since 2005. In 2008, my primary care physician diagnosed me with chronic kidney disease. A month or so after that, I went into Kaiser's kidney care program and saw Dr. Lanese.
Art was part of the clinic for a number of years, and as part of that, what we offer patients is a number of resources. A PharmD, a renal dietitian, a social worker, and then our MA, and then the physician. And we come together as a team. We see every patient, every visit, and try to assess not only their nephrology needs, but also their other needs, psychosocial needs. We go through their diet history and making sure that they're eating the right things, especially if they have other things like diabetes or hypertension that need special attention as well.
He told me that he's 82.
This program really helps from the standpoint of having a complete team emphasize slowing the progression of chronic kidney disease.
Art was one of those patients that was really engaged in his care, asked a lot of questions, wanted to be educated, was very proactive about all the things that he could and couldn't do in order to preserve his kidney function. Unfortunately, Art was looking toward dialysis toward the end of his course. Had talked to Art quite a bit about what his options were.
And then she said, you know, you'd be a good candidate for transplant, and so I'm going to refer you to Presbyterian St. Luke's so they can do their evaluation.
They evaluated him and found that he was a good candidate. And then in addition to that, they found that his wife, who was willing to donate, was also a good match for him. And so that was really good news. And so at the time when Art, just before he would have needed dialysis, Art's wife was able to donate her kidney to him.
I'm extremely thankful to Dr. Lanese for all of her support through this phase of my life, from being diagnosed with CKD to receiving the transplant. I just felt like I had wonderful support.
For the team, it was a celebration, both for his success as well as ours. And so we were very joyful.
I think the most important thing was they got to know me completely as a person and a patient.
We were just as much invested in Art as Art was, and so we basically celebrated this transplant with him.